effective cesarean prevention methodology is find a midwife.
Kind of gone downstairs for 2 minutes to grab himself a cup of coffee and the newspaper, and he comes back and the doctor is telling us, you're going to have a C-section for failure to progress.
First of all, no one permits anyone to use their vagina. So yes, I think that women should always be allowed to access their own choices, be given in true informed consent, true informed refusal, and be allowed to have whatever birth that they choose to have.
Statistically, it's safer than amniocentesis. I think women have to get back to sharing their stories and stop trusting in doctors. Doctors don't give birth, the male ones. I think we women have lost the sight of the fact that we have our own wisdom and our own power, and I think when we talk and we share, we learn that birth isn't such a scary thing. It's what we're supposed to do.
My advice is just to be in peace in that moment. Be in your home, or if you don't feel comfortable in a home, at least in a center where you know that you're going to be in peace and people are going to respect your rights.
I went in and had my C-section. As soon as my baby was born, they unhooked my arms, were tied down, and they unhooked my arm and allowed me to touch my baby. But I had so much medicine in my system, and then they were also giving me a shot to put me to sleep. And so I have no memory of seeing my baby for the first time. I have some photos.
I think we always have to look at pros and cons of anything, but essentially vaginal birth is the way babies were meant to come out, and so giving it a go after a cesarean is a reasonable choice.
After I left the hospital, no one talked to me about the birth. Nothing was said. It was very traumatic for me because of the general anesthesia as well, so I wasn't there for the birth. I woke up 3 hours later. Everyone else that held my baby. It was awful.
We love our uteri.
We love our uteri.
Deep down in our hearts.
Deep down in our hearts.
Deep down in our hearts.
Deep down in our hearts. I say deep, deep. I say down, down. I say deep down in our hearts. I say deep, deep.